So from our work so far, we can use ideas about the healthcare system to make a couple of observations relevant to artificial intelligence and the data that might underlie AI work. First, note the wide variety of players in the healthcare system and the different roles they're playing. It's just not the case that one can say, hey, we're going to work on AI in healthcare and stop there. It's important, and it can be really interesting to think about the different parts of the healthcare system and the different things they might want from AI. They all have different roles. Intermediaries, they've got a population and they have some responsibility for them. They've got risk that they need to manage. And so they're looking for tools that can help them do that. Maybe tools that can help identify possible health issues that they could see coming in their population better, where they could try and get involved and help those patients get access to the resources that would help. Providers are a little different. They're trying to provide healthcare to their patients, and they'd like tools that can help with that. They have to manage incoming information from patients. They have to sort that out into diagnoses and treatment plans. They may have to assimilate data from colleagues or systems, getting lab results, imaging results, for example, and interpreting them. They may benefit if they can better identify patients who are likely to need services in the future and get on top of that early. Patients themselves may have interests in keeping themselves healthy, of course. They may have interest in finding out whether they need medical care. So there sometimes can be patient-directed solutions. You know, the list could go on, but the lesson maybe isn't that complicated. If you're thinking about where to develop tools in this area, make sure you're thinking specifically about who in the healthcare system can use the tools and why they'd be motivated to use them. A second thing to notice has to do with the data. There are different entities here, and they'll have different kinds of data. Paying attention to who will have the data and why they'll have it can start to give you some insights. Providers often have data that comes from their work with patients. There are lots of records from work with patients that are kept these days in electronic systems that can be a really useful source of data. Some of this is kept in what we call electronic health records, or EHRs, so we call it EHR data. This can be really useful, but it also has its own idiosyncrasies, of course. Its main purpose is to aid providers in working with patients, so it may have lots of discussion or explanation in text fields that are not always easy to handle. It may have lots of detail on diagnoses or lab tests, but it may have less on payments or other business matters. It might be heavily regulated because there can be privacy concerns. Intermediaries will have a different kind of data. They're often interested in paying providers, so they may have records associated with that. Sometimes this can be super informative and it'll tell you things about where patients are getting services and how much they cost, but it will be different than electronic health record data because it's collected for different reasons and used in different ways. Governments are another group. They're regulating the healthcare system often, and they'll keep track of the services that they're regulating. They might keep track of data on the hospitals that they've licensed to operate. They might keep track of physician licenses to practice medicine. Other entities as well. Pharmacies may collect data on the drugs that they sell, for example. I'll stop with the list. You get the point. But when you're thinking about data and you're thinking about the problems you'd like to work on, it's really important to pay attention to the fact that the data are going to come from different sources, have been used for different reasons, and have different issues. We've now had a chance to develop a basic overview of the major pieces of a healthcare system and the people and the entities that work within one. We've also gotten a chance to look at some of the larger forces that are driving the conversations we're having about healthcare and that look like they are going to drive changes in the healthcare system going forward, creating a need for innovations, for new ideas, for new processes, for new technologies that can help us address these challenges.